All right. So she may not want you to solve it. Do you want me to listen, help you think through it, or help you take action? So do not guess the assignment because most of the time they're not asking you to solve it. So I don't want you to go in there and say, oh, well, I read this and you need to do this, you need to do that. No, you want to ask them, do you want me to listen? Do you want me to help you think it through? Just rebound things off of me, or do you want me to take action? A man, because he's a man, he immediately wants to take action. And that's not necessarily what they're asking you to do. Now, they may want you to take action. If they do, you ask them and you try your best to do it. But that may not always be the case. So don't just assume that she wants you to do something. So use this four-step support formula. Listen, let her finish before defending, correcting, or explaining. Now, she may be jumping on you for something that happened 15 years ago. Just listen because it's probably some unresolved conflict and you need to listen. You don't need to settle it right then. You just need to listen. And that's probably the most important thing that I've ever incorporated is that women want you to listen. When I'm in my office, I say, tell me the whole story. I like to hear it from the horse's mouth. And I sit back and I try my best not to interrupt her. I actually record it so that I don't have to be taking notes. I can hear exactly what she said, and then I can take it and I can formulate my notes and everything from there. So you want to validate. That sounds exhausting. I believe this is real for you. So even though she wakes up at 10 and says she's exhausted, you say, I understand it must be exhausting waking up at 2 or 3 o'clock in the morning, not being able to turn your brain off. Hey, let's see what we can do about it. So I hope that you'll look at this and you'll start to understand it. So ask, do you need space, support, or help solving something? Does she need you to fix something that you said you were going to fix 2 weeks ago? That's a lot of times my problem. Is that what I need to do, or do you just want me to listen? So also on TikTok or whatever, I saw a guy. He was like, he just doesn't know what to do. She'll tell him to go away and then say, "But don't stay away. You need to be closer." Or what? It's just this double-minded kind of things. But that's what the hormones are doing, and so it gets reflected in the relationship. So take one concrete burden off her plate, then follow up. Just say, "Hey, look, what can I do for you right now? Do I need to do anything?" If you do it, if you can't, then you try to figure out how you can try and resolve this. So change the words, you change the moment. Do not say calm down. Don't say that. That's aggravating. Don't ask why you can't say it. I don't understand why you can't say it. Just don't say it. You can say, let's pause. I'm here. You don't have to calm down. I'm listening. You don't have to raise your voice. I am listening to you. So don't say you're overreacting. You say, well, this feels intense. What do you need? I see this is really bothering you. How can I help you? Do you just need me to talk through with it? All right. You used to be different. To say, help me understand what's going on. She knows she used to be different. She said, I'm different. She to be like she used to be. You want her to be like she used to be. Everybody's on the same page there. So you never want intimacy. You don't say, oh, you don't love me. We hadn't had sex for 2, 3, 4 weeks. I'm telling you, the pressure does not help. You say, how can we feel close without pressure? Because intimacy to a man is totally different from intimacy to a woman. Intimacy to a woman is feeling close, being safe. Number one is feeling safe. Safe in the relationship, safe in her own body, safe with her own hormones, safe with her own emotions. And until she can feel safe, then intimacy is really out. I won't say it's out of the question. It's going to be much more difficult. And then I'll tell you, a lot of women, they have sex because they feel like they need to keep you happy or keep you from causing more stress. So they do it more out of obligation. And I think if a man is really in touch with his woman, he can feel that is more out of obligation. And when you feel that, that's the time to say, hey, let me give her what she needs, not what I want. So that's what you have to do in any relationship. It has to be more about what can I provide for you and vice versa. All right, that's a good relationship. I'm always thinking about you. You're always thinking about me. So now everybody is being heard and being understood. And that is what I have found to be the most important thing. So intimacy improves when pressure decreases. So what closes the door? If you criticize her throughout the day, affection that always demands sex, body comments disguised the concern, oh, you're not fitting that dress like you used to, or whatever, trying to negotiate intimacy during conflict. So, what does help? Affection without expectation, honest conversation outside the bedroom. My wife has always tell me that intimacy starts way before we ever go to bed, and that's something that men have to learn. Curiosity about comfort and desire, shared responsibility, rest, patience, and emotional safety. I'm telling you, that's what women want. They want to feel safe. That's why they go for the big athletes and whatever, because they can make them feel safe. Now, whether it's a good match emotionally or relationship wise, that's a whole nother story. But that's what women look for. Who can make me feel safe? And again, I'm not okay. So let me not be sexist. I'm talking about evolutionary. This is how a woman's brain is naturally wired. But can that be changed? Is a difference? Okay, I'm not trying to be stereotypical. I'm just telling you this is how the man and a female brain works. And why do they work differently? Because they're governed by different hormones. The only consistent hormone that spans everybody is cortisol and stress and epinephrine and norepinephrine, all of these, the sympathetic and the parasympathetic nervous system, that works the same in everyone, but it can be influenced by these hormonal changes.